Hello everyone, I am Dr. Priyanka Sachdev here and I welcome you all for today's session. Today I am here to discuss few image-based questions. We know as the pattern of most of the competitive exams are changing and image-based question is a new pattern in which 30% of the paper is from image-based question. So understanding image-based question is really, it is the need of the hour. And hematology is a topic, is the area from which many image-based questions can be framed. So today I am discussing few image-based questions from hematology. Hematology also have divided complete hematology in three parts. The first part is leukemia and lymphoma, which is I am going to discuss today. Only image-based questions from leukemias and lymphomas. Then after that I will discuss anemias, RBCs, anemias, and then platelet disorders. So image-based questions I am going to discuss from hematology, from leukemia and lymphoma in this lecture. I hope you will enjoy it. You will learn a lot. So this is the first question. Without wasting time, this is the first question in front of you. So read the question, read the four options, then we will discuss what is the correct answer. So you can see what is the diagnosis. An image is given and it is asked in the question, what is the diagnosis? What is the diagnosis? So you can see the image. The image is showing what? Is it a lymphoblast? Is it a myeloblast? Is it a megakaryocyte? Is it a normoblast? So I will show you the image separately also. Now see the image. See what are the features given in the image. Can you see? A cell is given. So you can see the NC ratio of these cells. So these cells are blast. Look at the NC ratio. All of them are blast. These are blast cells. So it is a blast cell. Okay, but there are two options for the blast. Whether it is a lymphoblast or it is a myeloblast. Which blast it is? So a clue is given in the question. Can you see an arrow is given in the question? There is an arrow in the question. Look at the arrow. The arrow is pointing towards the cytoplasm. In the cytoplasm, some rod-like structures, reddish rod-like structures are present in the cytoplasm of all these cells. These rod-like structures, yes? Do you have any guess? What are these rod-like structures? And based on that, how I will decide? And there is an aggregate of these rod-like structures. Based on these structures which are present in the cytoplasm of these blasts, how I will decide whether it is a lymphoblast or myeloblast? Yes, it is a myeloblast because these rod-like structures present in the cytoplasm are iron rods. These are iron rods. So what are iron rods? Why it is myeloblast? The answer is myeloblast. Your guess is absolutely right. It is iron rods present in the cytoplasm which gives a clue that the image is of myeloblast. Iron rods are never present in lymphoblast. So first you have to identify it is a blast. Based on NC ratio, I have identified it is a blast. See the nucleus of each of them. The cells are large. The cells have high NC ratio. The nucleus is hyperchromatic. So it is a blast. So from the blast, we have two options, lymphoblast or myeloblast. Normoblast is a normal cell which is present in the bone marrow while formation of the RBC, early normoblast, intermediate normoblast, and late normoblast. So these are not actually, and megakaryoblast is also a normal blast which is formed in the bone marrow during the formation of platelets. So it is based on this finding, the rod-like structures, that is iron rods present in the cytoplasm only in myeloblast, not in any other of the blast. So that you should understand. That is the thing. It is showing iron rods. Have you got it? Now listen, there are 5 types of WBC, you know. There are 5 types of WBC. Just a second. How many types of WBC we know? WBC are of 5 types. Some of them are granulocytes. Some of them are agranulocytes. Granulocytes are of 3 types. Neutrophils, eosinophils, basophils based on the color of granules. In neutrophils, we have pink or purple granules. In eosinophils, we have brick red color granules. And in basophils, we have dark blue or black color granules. Agranulocytes are of 2 types. They do not have granules in their cytoplasm. So it is monocyte and lymphocyte. So you know these cells, all these cells, neutrophil, eosinophil, basophil and monocyte, these are formed from myeloblast in the bone marrow. Myeloblast from the bone marrow. And only lymphocyte is formed from lymphoblast. So there are 2 types of blast, lymphoblast and myeloblast in the bone marrow. So this is these are the 5 types of WBC. You can see this is neutrophil having pink granules, purple granules in the cytoplasm. This is eosinophil showing brick red granules in the cytoplasm. And this is basophil showing black or deep blue color granules in the cytoplasm. These 2 are agranulocytes, that is lymphocyte and monocyte. They do not have granules in the cytoplasm. So these 2 are agranulocyte cells. So the granulopoiesis, formation of WBC, all the cells are formed from a single cell, hematopoietic stem cell. So listen, this is a bone marrow. Let me draw a bone marrow for you people. This is a bone marrow. In the bone marrow, the first cell is hematopoietic stem cell. From hematopoietic stem cell, myeloblast is formed and lymphoblast is also formed. This lymphoblast give rise to lymphocytes and myeloblast give rise to rest of the WBC, that is neutrophil, eosinophil, basophil. These are the granulocytes, and from agranulocyte it is monocyte. So lymphoblast and myeloblast are the two type of blasts present in the bone marrow. So you can see it is myeloid series forming all these, and it is lymphoid series forming only lymphocytes. So the two type of blasts are present. Now listen, you can see this is myeloblast. From the myeloblast, the neutrophil is formed. This is how neutrophil, these are the intermediates. From the myeloblast, this is myeloblast. Promyelocyte is formed, then metamyelocyte is formed, then myelocyte is formed, then metamyelocyte is formed, then band form is formed, then neutrophil is formed. So what are the intermediates? It is myeloblast, promyelocyte, myelocyte, metamyelocyte, band form, and neutrophil. This is how neutrophil is formed from the myeloblast. And this is lymphoblast. You can see this is lymphoblast. From the lymphoblast, this is lymphoblast, pro-lymphocyte is formed, and then lymphocyte. So these are the intermediates for the formation of lymphocyte. You should know the complete series. Now there are four types of leukemias we know. There are two types of lymphoid leukemias, that is ALL and CLL, acute lymphoid leukemia, chronic lymphoid leukemia. And there are two myeloid leukemias, that is AML and CML, acute myeloid leukemia and chronic myeloid leukemia. In the lymphoid leukemias, lymphoblast come in the blood. Lymphoblast come in the blood. And in the myeloid leukemia, myeloblast come in the blood. Normally blasts do not come in the blood. The blast, myeloblast as well as lymphoblast, both the blasts are present in bone marrow. Okay, let me take a white sheet. Okay, so this is the bone marrow. You can see this is the hematopoietic stem cell. You can see from the hematopoietic stem cell, you can say the two blasts are formed. This is myeloblast and this is lymphoblast. These are the two types of blasts which are formed from the hematopoietic stem cell. From the myeloblast, ultimately neutrophil is formed. From lymphoblast, ultimately lymphocyte is formed. And lymphocyte and neutrophil come in the blood. It is the lymphocyte and neutrophil which is coming in the blood. Blasts do not come in the blood. But whenever some mutations are taking place inside the blast, inside the nucleus of the blast, they have uncontrolled mitosis. So they replace the whole bone marrow, and these myeloblast and lymphoblast come in the blood. That is known as leukemia. So when myeloblast come in the blood, it is known as myeloid leukemia. It is of two types, AML and CML. When lymphoblast come in the blood, it is known as lymphoid leukemia. Again, it is of two types, ALL and CLL. Have you got it? Have you got it? So four types of leukemias are there, AML, CML, ALL and CLL. We have four types of leukemia. You can see the two types of blast. So how the question arises, how you will identify this is a lymphoblast and this is a myeloblast. How you will identify looking at the morphology. So see the diagram of the two blasts in front of you, a beautiful diagram showing the absolute differences between the two. You can see this is a myeloblast. Myeloblast is larger as compared to lymphoblast, little larger. Cytoplasm is moderate in myeloblast, but in lymphoblast very scanty cytoplasm is there. You can see nucleus. Inside the nucleus, you can see these are prominent nucleoli. Inside the nucleus of myeloblast, prominent nucleoli are present. Here nucleoli are indistinct. Here nucleoli are indistinct. Now the biggest difference is iron rod. Can you see the cytoplasm of the myeloblast, a rod-like structure is present. This is known as iron rod. Iron rod is a feature of myeloblast, not a lymphoblast. So based on this feature, our question was there. So we have two blasts, myeloblast, lymphoblast. Myeloblast and lymphoblast, the biggest difference between them in the cytoplasm of myeloblast, we have iron rods. In the cytoplasm of lymphoblast, iron rods are absent. It is agranular. No granules are present, no iron rods are present. And based on this, we have made our question. So you can see here also, can you see iron rod here? See here in the cytoplasm of the iron rods. You can see other differences also, but the biggest difference which distinguish the two is iron rod. See here also. It is myeloblast which has iron rod in the cytoplasm. So I hope you got it. This is the next question in front of you. This is the next image-based question from leukemias in front of you. We will read the question. We will see the image in detail. Then we will tell the answer. Okay, it is not MCQ, the four options. I have asked three questions. So what type of leukemia it is? So this is a picture of leukemia. What type of leukemia it is? First, you have to tell me the diagnosis. Then explain the clinical findings and what is the prognosis of this leukemia. So three questions are there. Three questions, three answers. Okay. Let me tell. So age is always a clue. Age is always important in all types of leukemia. There are 4 types of leukemia and age is important in each of them. So there is a 41-year-old man with fatigue and fever. Fatigue represents anemia. Patient is having fatigue, lethargy because he's anemic. He's anemic. Fever represents infection. So WBC are maybe increased or decreased, but they are non-functional. The WBCs are non-functional. That's why the patient is having fever. So fatigue, fever and petechiae and epistaxis is representing thrombocytopenia. Platelet is less. So in short, patient is having pancytopenia. RBC are less, so fatigue is there. WBC are less, so fever is there. And petechiae and epistaxis are there. So patient is having platelet also less. So the three things. So you can see hemoglobin is only 6.7. So normal hemoglobin range, you know. So patient is severely anemic, you know. Platelet count is also less. It is only 9,000 something. So normal platelet count is 1.3 lakh to 4 lakh. So platelet. So patient is having anemia, thrombocytopenia, but WBC count is more. It is 1,68,000. 1,68,000. Normal WBC count is 4,000 to 11,000. So you will say, ma'am, WBC is more, than why the patient is having infection? All these WBCs are ineffective. They are there, but they are not real WBC. They are the blast. As I have told you, blasts are coming in the blood. So see the peripheral smear. Now it is a typical picture of leukemia. So age of the patient is a middle-aged male. 40-year male is there. 40-year with anemia, with thrombocytopenia, that is RBCs are less, platelet are less, WBC are more, but still patient is having fever. So typical picture with this diagram. Now see the cells. See the cells. These all are blast cells. See the NC ratio. These all are blast cells. If these are blast, you have to, the first thing you have to identify whether it is a myeloid blast or lymphoid blast. Myeloblast or lymphoblast. See the cytoplasm. Search for iron rods. You know now. Can you see the cytoplasm? Zoom it out and see. See these iron rods. See these iron rods. These iron rods. See this iron rod. So see this iron rod. All blast contains iron rod in them. So it is myeloblast. It is myeloblast. So if it is myeloblast, it is a myeloid leukemia. Myeloblast is there. So it is a myeloid leukemia. Now we have two options, AML and CML. Both of them are myeloid leukemias. The answer for this picture is AML. Because in CML, along with blast, you will find other intermediates also. That is promyelocyte, myelocyte, metamyelocyte and band form. In CML, you will find all precursors. But in AML, you will find only myeloblast. So here only myeloblasts are present. So the answer is AML. The answer of this is AML. Prognosis of AML is poor. Relapse is very common. Cure is very rare. So prognosis and how you will explain the clinical findings. Why the patient is having three things. Why these three things are there. Why patient is having fatigue. Why he is having fever. Why he is having petechiae. So okay, we will draw the same diagram again. Okay, this is the bone marrow. This is hematopoietic stem cell inside the bone marrow. Normally it forms myeloblast. Then promyelocyte, myelocyte, metamyelocyte, band form and neutrophils are formed. These neutrophils come in the blood normally. Normally these neutrophils come in the blood. But now due to mutations in the hematopoietic stem cell and myeloblast, the entire marrow is flooded with myeloblast. Myeloblasts are having uncontrolled mitosis. So they will spill into the blood and myeloblast will come in the blood. In the bone marrow, along with WBC formation, we have RBC formation and platelet formation also from the same cell, hematopoietic stem cell, from the same myeloblast. But myeloblast is forming abundant myeloblast and RBCs and platelets are also not formed. So less RBC leading to anemia, fatigue, less platelet leading to thrombocytopenia and petechiae and epistaxis. So this is how, and WBCs are more, I agree, but these WBCs are not mature neutrophils. These are immature myeloblasts. So these are ineffective. They will not protect, they will not provide the defense mechanism. So patient is having infection. So this is how we can explain the clinical findings. Give me a thumbs up. So because of the presence of iron rods, we have identified that it is a myeloblast. It is a myeloblast and it is AML. Because of myeloblast, it is AML. Patient is having pancytopenia because of immature myeloid forms, that is myeloblast is replacing the complete marrow and relapse is common, so prognosis is poor. So 3 questions, 3 answers. Coming on the next question. So this is the myeloblast. You got it? It is the myeloblast. It is replacing the entire marrow. It is replacing the entire marrow. This is the next question in front of you. Read the question. See the image separately. See the arrows in the image. What the arrows are indicating. They will indicate something. Then tell me the answer. Which type of leukemia it is. Again, it is a leukemia. But which type of leukemia? What is the cytogenic mutation in this type of leukemia? First, make the diagnosis. Then tell me what is the cytogenic alteration in this type of leukemia. What therapy you will offer the patient. What treatment you will offer the patient? Name drug, name specific drug. So 3 questions, 3 answers. Okay, let me read the question. Again, age is important. Again, he is a middle-aged male. 45-year-old male is there with an 8-month history of fatigue, weight loss. So patient is having fatigue, again anemia, weight loss is there. And splenomegaly is there. Patient is having splenomegaly. Hemoglobin is 9. So again anemia. Platelet is also 5,50,000. It is little bit more. It is little bit more, but not less. And WBC count is 2,50,000. So high count leukocytosis is there. Normal is 4,000 to 11,000. Peripheral smear is given to you. See the peripheral smear. What it is showing? What it is showing? Okay, what cell it is? Can anyone tell me what cell it is? See, zoom it out and see the granules. It is having red color granules. The cell is having red color, binucleated cell with red granules. It is the eosinophil. What cell it is? This one. I'm marking this one. It is having black or blue color granules. So it is having a basophil. It is basophil, dark blue color granules. What cell it is? This one. This one. It is a blast. It is a myeloblast. And what cell these are? This one. It is a band form. This one is a band form. This is a metamyelocyte. This is a promyelocyte. This is a myelocyte. So I'm getting the complete range. So what I am getting in the blood? In the blood I am getting myeloblast, promyelocyte, myelocyte, metamyelocyte, band form. I am getting the complete precursor and neutrophils. Neutrophils se pehle kya all precursors are present in blood along with eosinophils and basophils. Eosinophils or basophils are also increased in number in the blood. So it is a myeloid leukemia, of course, and it is CML. It is a typical picture of CML in which you will get blast are few, but other immature myeloid cells, that is promyelocyte, myelocyte, metamyelocyte, and band form are more in number. And there is basophils and eosinophils also. So that is a typical picture of CML. In CML, what is the abnormality? What is the cytogenic abnormality in CML? You know, humans, all cells. I'm talking about which cell? I'm talking about myeloblast. So, okay, let me take a slide. So this is the bone marrow. This is the first cell, myeloblast. All cells have nucleus. So this is the nucleus of myeloblast. All cells have 46 chromosomes, 23 pairs of chromosomes. So let me draw this myeloblast separately on different page. So let me take a page. This is the myeloblast. This is the nucleus of the myeloblast. There are 23 pairs of the chromosome. Let me draw pair number 9. And let me draw pair number 22. On pair number 9, there is a gene known as ABL. On chromosome number 22, there is a gene known as BCR. This is normally present. It is normally present on pair 9 and this is the name of the gene. Now mutation occurs. Due to mutation, physical, chemical, viral, carcinogen mutation is taking place. Due to mutation, exchange of genes takes place between the two chromosomes, that is translocation. The name of the mutation is translocation. So in exchange, ABL is given to 22. ABL gene. So ABL 22 was already having BCR or ABL bhi wahan pahunch gaya. So because of fusion of ABL and BCR, a new gene is formed which is known as fusion gene. This fusion gene, with the help of transcription and translation, it forms an enzyme known as tyrosine kinase, which is abnormal and it leads to uncontrolled mitosis. And because of uncontrolled mitosis, it is spilled out in the blood. So all the precursors are spilled out in the blood. So cytogenic abnormality is 922 translocation. It is 922 translocation, also known as BCR-ABL fusion gene formation. So BCR-ABL is present on 9, BCR is present on 22 and fusion occurs. So fusion gene is known as Philadelphia chromosome. The fusion is known as Philadelphia. And what is the therapy you offer here? So we offer a therapy which inhibits that abnormal tyrosine kinase. The name of the drug is imatinib. Imatinib is the therapy. That is a targeted therapy. That is a selective tyrosine kinase inhibitor which is formed as a result of this fusion gene. So if we inhibit it, patient will not have any symptoms. Have you got it? So that is the first targeted therapy discovered. That is imatinib. Very, very important. Next question. So you can see here. So what is the image showing? So read the question. Okay, I will show you the image separately also. Okay, a 70-year-old male is there. With painless cervical lymphoadenopathy. So patient is having lymphoadenopathy, cervical lymphoadenopathy with PALAR. PALAR means anemia. Patiki means thrombocytopenia. And peripheral smear is given to you. See the peripheral smear. There are some arrows. What does these arrows are indicating? What are these cells? These are looking like some broken cells. I can't find the nucleus. I can't find something. These are broken cells. These all are broken cells. These are known as smudge cells, or also known as basket cells. Basket cells, which is a hallmark of CLL, chronic lymphoid leukemia. In CLL, we found these cells. We found these cells. Have you got it? It is typical scenario of CLL. These are smudge cells. These are known as basket cells. So what are these smudge or basket cells? So these are actually lymphoblasts. These are actually mature lymphocytes. So when we when we make the smear, how we make the smear? We take a slide. On the slide, we take a drop of the blood. Then we spread it and form a smear. So these are very fragile cells. So while forming the smear, they just broke out and they will form the basket cells and smudge cells. So that is the reason why they are formed. These are very fragile cells. Have you got it? And this is a typical hallmark of CLL. So in CLL image, you will always find smudge or basket cells. You will always find smudge, or you just learn it. So till now, I have told you in AML, you will find myeloblast containing iron rods. So if it is, the answer is AML, you should find iron rods inside the myeloblast. If it is CML, in the diagram, you will get a eosinophil, you will get basophil, and you will get all precursors. That is myeloblast, promyelocyte, metamyelocyte, myelocyte, and band form. You will find all precursors. It is not you will find only myeloblast. So that is the hallmark of CML. In CLL, you will find smudge cells. So the smear is very typical of all four types. I will tell you ALL also. So the smear is very, very typical. Looking at the image, you can identify which type of leukemia out of the four it is. So it is smudge and basket cells, which are the nuclear remnants of the cell damaged by the physical stress while making the smear. So while making the smear, due to the physical stress, these are formed. Have you got it? That is CLL. This is the next question in front of you. Again, identify the type of leukemia. Identify which type of leukemia it is. Okay, we will read the question. Read. It is a 9-year-old boy. So age is important. He's a child. Child में चारों में से कौन सा leukemia होता है? Only one leukemia occurs on child out of the four. So he is a child with fatigue. Fatigue means anemia. Epistaxis and easy bruisability. It means thrombocytopenia, and pneumonia as an infection means pancytopenia. It is leukocytopenia, so it is pancytopenia. So all three things are less: RBC, WBC, and platelet. On examination, he is having bone pain and splenomegaly and lymphoadenopathy. So three things are there: bone pain, splenomegaly, and lymphoadenopathy. Three things are there. Blood smear is given to you. Identify the type of leukemia. See the cells. See this cell. It is a blast. C-NC ratio. It is a blast. It is a blast. Which blast is this? All these cells are blast. All these cells are blast. See, the cytoplasm is extremely scanty. I can find only nucleus. Hardly any cytoplasm is seen in all these cells. And there is no iron rod in none of them. So it is a lymphoblast. So the smear is full of lymphoblasts. So the answer, and he's a child. He's a child. The smear is full of lymphoblast. So answer is ALL. It is typical smear of ALL. Listen now what is happening. I would like to tell you something here. It is a typical smear. Why the patient is having this splenomegaly? Why the patient is having bone pain? Why the patient is having lymphoadenopathy? How you will explain the clinical findings? I'm sorry. Just a second. Okay. Okay. Can you see here? Okay. Can you see here this one? Okay, I will say again. Okay, can you see this is the bone marrow? In the bone marrow, you can see this is the hematopoietic stem cell. This is the lymphoblast. So some mutations takes place inside this lymphoblast. So they just proliferate due to uncontrolled mitosis. They come in the blood. So blood is full of lymphoblast. We see the peripheral smear is full of lymphoblast. After this is known as leukemia. This is known as ALL type of leukemia. After coming in blood, they enter various organs. So they enter the liver causing hepatomegaly, they enter in the spleen causing splenomegaly, they enter in the lymph nodes causing lymphoadenopathy, they enter in other bones causing bone pain, so they enter in CNS also, so they enter in various organs and produce lymphoma. So leukemia got converted into lymphoma. So this is how you can explain the other symptoms. So explain the clinical findings. I have explained you why it is happening, the other things. So due to pancytopenia, patient is having fatigue, thrombocytopenia, bleeding, and he is having bone pain. And the last question, what enzyme is expressed in these cells? So these lymphoblasts express one typical enzyme known as TDT. Learn the name of the enzyme, TDT, terminal deoxynucleotide transferase. So we are done with the four types of leukemias. So I have told you AML, CML, CLL and ALL. Who will tell me one typical finding in the peripheral smear in the image of them? In AML, you will find myeloblast containing iron rods. Only myeloblasts are present containing iron rods. Typically in CML, along with myeloblast, you will get promyelocyte, myelocyte, metamyelocyte, band form, neutrophils, eosinophils, basophils. So you will find the complete range. And iron rods are not necessarily seen here because myeloblasts are very less in number. Here myeloblasts are abundant. The smear is full of myeloblasts. So here both the leukemias contain myeloblast. That's why these are myeloid leukemias. Coming on lymphoid, no one will explain you with such simplicity. So coming on lymphoid leukemias, in lymphoid leukemias, you can see here in CLL, you will find mature lymphocytes. You will find mature lymphocytes which are very fragile, and because of the physical stress during the smear formation, smudge cells and basket cells are seen. So smudge or basket cells are typically seen in the smear. In ALL, you will find lymphoblast without iron rods. Lymphoblasts do not contain iron rods. The smear is full of lymphoblasts. So these two are lymphoid leukemia. So let's see. First see the myeloid leukemia. So this is myeloid leukemia. They all contain myeloblast. So in myeloblast, see the first image. Can you see iron rod, iron rod, iron rod, iron rod, iron rod? The zoom image of the same. Let me zoom and show you the same image. Iron rods. Can you see iron rods? So examiner can give you a low power image as well as a high power image. You have to see for iron rod. If iron rod is there, diagnosis is straightforward. It is AML. It is AML. See the second image. You can find a eosinophil. You can find a basophil. You can find the complete range. It is myeloblast, promyelocyte, myelocyte, metamyelocyte. So it is CML. It is CML. It is CML. Now see lymphoid leukemias. I will teach you both. Lymphoid leukemias, they will contain lymphoblast or mature lymphocyte. So see this image. They contains basket cells or smudge cells. These are basket or smudge cells. So it is typical CLL. It is typical CLL. And see this cell. All of them are blast. So see, cytoplasm is scanty and they do not contain iron rods. So it is ALL. And he is a child. He is a child will also be a clue. That is ALL. Give me a thumbs up. Give me a thumbs up. I am done. Everyone give me a thumbs up. Everyone. Have you got it? Okay. Okay. One more question. The image shows. The following image shows what? You tell me following image shows what? So it is also a type of leukemia. Is it showing the arrow in the image? Can you see this cell? See the cytoplasm of the cell. See the cytoplasm. See the cytoplasmic extensions of the cell. They are looking like hairs. So yes, the answer is typical. It is hairy cell leukemia. So in hairy cell leukemia, the image shows the presence of immature B cells with hairy projections on the surface. So this is how. Can you see the hairy projections on the surface? These are the cytoplasmic extension. It is typically hairy cell leukemia. Hairy cell leukemia. Hairy cell leukemia. One more last cell in front of you. Last question in front of you from leukemias and lymphomas. Identify the cell marked. Can you see the cell? Can you see the cell is binucleated? There are two nucleus and it is looking like owli. Owli. What it is? What it is? Yes. No, it is not owli inclusion. It is seen in CMV. It is RS cell. RS cell typical of Hodgkin's lymphoma. It is a RS cell. RS cell typical of Hodgkin's lymphoma because it is having bilobe nucleus with prominent nucleus. So here this is the cell. Okay, let me draw the cell. This is the cell. The cell contains bilobe nucleus with prominent nuclei looking like owli. This is the typical RS cell. RS cell, Reed-Sternberg cell. There are 5 types of Hodgkin's lymphoma. I'm not teaching you all. You know them. It is nodular sclerosis, mixed cellularity, lymphocyte rich, lymphocyte depleted, and lymphocyte predominant. All of them have RS cell but different type. Nodular sclerosis has lacunar type of RS cell. Mixed cellularity and lymphocyte rich. Both of them have classical. ये जो image बताया that was for classical owli. Classical RS cells. Lymphocyte depleted have pleomorphic type RS cells and lymphocyte predominant have popcorn type of RS. So you should know the image of all of them. This is popcorn type. You can see here it is popcorn type. You can see this is lacunar. A lacuna is present around it, a white color. This is typical classical owli, bilobe nucleus with prominent nuclei, and this one is pleomorphic. So you should identify the 4 type of RS cells for your image-based questions. So thank you. I hope you really learned out of it. I have taught you the leukemias, all 4 types of leukemias, CML, CLL, AML, ALL. What is the peculiarity in peripheral smears? Among lymphomas, Hodgkin's lymphoma is important. So you should know RS cell finding of all types of Hodgkin's lymphoma, and hairy cell leukemia. Burkitt is also important. So you can do the MCQs now. Okay, so that was the image-based question. Thank you very much. Don't forget to give your feedback. If you want detailed lectures, so more IBQs, More of these IBQs are available on the Unacademy Learners app. So install Unacademy Learners app from the Play Store. Go to the Play Store, install Unacademy Learners app from the Play Store. Select goal as NEET PG. Go to NEET PG category. In the NEET PG category, you will find my profile link. Search my name. My name is Dr. Priyanka Sachdev. So you search my name, you will find my profile link. Just follow it. You will get a list of my recorded lectures. All of them are free. You can download the notes also, but you will require a code. The code is Sachdev10. Please remember the code. SACHDEV, Sachdev. That is my surname. Sachdev10 is the code. If you apply this code, you will get all recordings there, and you can watch the lectures free of cost. Yes. And if you want to take a paid subscription, the paid subscription is of two types. Paid subscription, it is Plus and Iconic. So better to go with paid subscription, Iconic. So there are two types. In Plus subscription, you will get only Unacademy recorded lectures, live and recorded. In Iconic, along with Unacademy, you will get Preparator also. And on paid subscription, we have many other features. We have raise a hand feature in which you can connect with me on an audio call during the class. So it will be a classroom feeling, And there are more than 25,000 high yielding MCQs available on the app, which are updated recently. And you can do your practice there till you become perfect. We are really proud of our star learners, and they all got selected. I want your photograph next to be here. So you have to work hard for it, and you have to connect it with us for that. And these are the various batches available on the Plus platform. You can get advantage of all these batches if you take the subscription. Last two offers for you. If you take a subscription for 12 months, you will get 2 months extra. If you get a subscription for 24 months, you will get 4 months extra. And apart from it, you can see these are the prices of Iconic subscription, and these are the various subscription for Plus. In Plus, the minimum is 1 month and the maximum is 4 years. So whatever you want to take, you can select your best plan. Longer the plan, cheaper it is. So if you are a first prof, second prof, pre-final year student, go for a longer plan, 4 year, 3 year, 2 year. That will be cheaper for you. But if you are an intern or final year student, you can go for 1 month, 3 months, 6 months. So depending on you, whatever plan you select, that is best for you, you should select that plan. And whatever plan you select, the code is saying Sachdev10. If you apply the code before payment, you will get 10% discount. So the summary is that the code is useful for all students. Those who want to attend the classes for free also, those who want to attend the classes paid one also. The one who want to attend the free classes, they can unlock the free classes, only free classes, not the paid one they can unlock. They can unlock the free classes using this code, and the one who are taking the paid subscription using this code, they will get heavy discounts. So don't forget the code and distribute this code to everyone. See you. Bye-bye. I'm ending this lecture.